How to relieving pink eye itching in children. Have you ever noticed your child rubbing their eyes and wondering why? It could be pink, also known as conjunctivitis. This condition can cause itching and discomfort, but there are ways to help relieving those symptoms. First, it is essential to determine what type of conjunctivitis your child has, as the treatment can differ based on whether it is bacterial, viral, or allergic. To start with general relief, applying a cool compress gently over your child's closed eyes can be very soothing. This can help reduce inflammation and ease the itching. You can also use artificial tears, which are lubricating drops that help relieving dryness and irritation. Keeping the area around the eyes clean is important too. Gently wipe away any crust or discharge with a warm, damp cloth to keep things tidy. If your child has allergic conjunctivitis, which often leads to significant itching, you might want to consult your child's doctor. They may recommend antihistamine eye drops or oral allergy medications to help reduce the itching and inflammation. It is also a good idea to avoid any allergens that might trigger your child's symptoms. In cases of bacterial conjunctivitis, itching can be present but is usually accompanied by discharge. Treatment for this type typically involves antibiotic eye drops or ointments prescribed by a healthcare provider. It's crucial to remind your child not to rub their eyes, as this can worsen irritation and spread the infection. You should notice improvement in itching as the antibiotic treatment takes effect, usually within a few days. For viral conjunctivitis, the good news is that it often resolves on its own without specific medication. You can still help relieving symptoms with cool compresses and artificial tears. Again, reminded your child to avoid touching or rubbing their eyes to prevent worsening symptoms and spreading the infection. There are also some additional care tips to keep in mind. Encourage your child to wash their hands frequently to prevent spreading the infection. Avoid sharing towels, pillows, or washcloths. Keeping your child's fingernails trimmed can also help minimize damage from scratching. If your child wears contact lenses, it is best to stop using them until the infection clears and a doctor gives the go-ahead. It is important to know when to seek medical advice. If your child's itching is severe, persistent, or accompanied by pain, vision changes, swelling, or light sensitivity, consult a healthcare provider promptly. If symptoms do not improve within a few days of treatment or worsen, a medical reassessment is necessary. In summary, relieving pink eye itching in children involves soothing measures like cool compresses and artificial tears, managing allergies with antihistamines if applicable, and treating bacterial infections with antibiotics. Always follow a healthcare professional's guidance to ensure safe and effective care tailored to your child's specific type of conjunctivitis. Avoid rubbing or scratching the eyes to prevent further irritation or spreading the infection.